Let's talk about emotion-focused strategies for a minute. These include exercise, relaxation, praying, meditating, passive social support, talking to other people, not necessarily experts. Examples are Jacobson's progressive relaxation techniques, where you alternately contract your muscles and learn to relax. This is not something that you just go do, it's something that you have to practice. It's a skill, but it's been shown to be very effective in helping you relax. You need to learn to identify tensions in the body and release them and allow yourself to relax. Autogenic relaxation training refers to combining deep rhythmical breathing with soothing imagery. You think about things that are comfortable to you, floating on water, floating on a cloud, something to help relieve your feelings of heaviness and warmth facilitate the process. Again, this is something that you can train with people who can help you learn to use this technique, and with practice you can get quite good. Biofeedback includes utilizing a machine to monitor physiological response. For example, keeping track of your heart rate and trying to soothe your system and slow down to try to use that as a signal that you're relaxing by having a lower heart rate. This has been shown to be very useful for headaches, asthma attacks, high blood pressure, hypertension, and again, it's a skill that has to be learned. Meditation and imagery also relies on deep breathing, facilitated by images of peace and internal relaxation. Again, this is some associated with yoga and other Eastern philosophies, can be very helpful, but again, it's not something that you just go do, it's something that you have to practice. Praying can also be a very important motion-focused strategy. It can reduce blood pressure, it's been shown, can provide inner comfort, has a demonstrated calming effect on many people, and it can, for many people, improve feelings of self-confidence. Of course, exercise provides a break from reality and normal things. It improves your mood and can enhance self-esteem. And generally, the type of exercise that's most effective that involves no competition, especially for those for whom that's a specific problem. In terms of specific exercises, we know that yoga can be good, although I do caution you that some forms of yoga have some dangerous or risky exercises, but in general, if done properly and progressively, can be very good as a relaxation form. Also, there are some very specific exercises that you can do. Let's talk now about some of the exercises that you might perform. One would be the neck stretch. And this you do in half circles, rotating on a clock from 3 o'clock to 9 o'clock and 9 o'clock to 3 o'clock. You don't rotate your neck backwards. You keep your neck loose and relaxed. As I mentioned, don't tip the head back. The shoulder lift, you hunch your shoulders up high, lift up, and then drop the shoulders and relax. Sitting and with your arms on your knees and in a relaxed position can be very helpful. The trunk stretch and drop involves standing and reaching as high on your toes as possible. Inhale on the stretch, reach up, then relax, drop down like a rag doll, bend your knees, let the trunk fall forward, collapse, exhale on the downhill. Don't stand with the knees straight as in a standing toe touch, which is a contraindicated exercise. Another is the trunk swing, where you stand and rotate your weight back and forth, shifting the weight from one foot to another, keeping the upper body loose, arms dangling, moving side to side. The heels come off the floor, breathing as you go. This is another effective method of using exercise to relax. The final one is the tension contrast. You lie on one side with your arms above the head, tighten the muscles very tightly, and then relax and allow the body to tip either forward or backward, and then stay in that relaxed position for a period of time and repeat if necessary to relax. Another thing that you can do is called the quick time out, and what this involves is just sitting in your chair and doing deep breathing, trying to slow your respiration rate, trying to reduce mental